Improving streamline in swimming is such a controversial topic, and how do we really do that effectively? Do we stretch? Do we do mobility? What kind of mobility? How long? Well, this video I'm going to show you how my streamline is improving as I'm getting older, and I wish I knew all these techniques as I was a college swimmer. And it's super simple. It's literally 3 bodyweight movements, a little mobility work, and after that we're going to use a peanut ball. Stick around if you want to do it. YouTube, welcome to this video. My name is Dennis Hekmati. I'm a performance coach and a sports scientist bringing you guys these videos. If you like them, like, share, subscribe so we can stay alive and bring you guys more valuable content like this, and hit the notification button if you want to get notified as soon as we have the next video. Do you want to get better with your streamline? Let's go! For today's workout, our main objective is to increase mobility. For me, mobility means increasing joint and muscle function. And typically, if we want to improve streamline, it's going to be overhead and in a very unnatural end range kind of position. And to help us, we're going to use a peanut ball. If you have not gotten a peanut ball yet, I highly suggest you getting yours in the store. And now, let's look at how we can use this with a few bodyweight movements to get going. Now, a few little rules before we do this though. We have to be warmed up with this peanut. It's not as easy as just waking up and getting out of bed and getting on this peanut. We actually need the muscles to be warmed up. That's why we are doing a few movements first. So if you want to do some movements before you jump in the water, very appropriate. If you want to do it before you go to bed and you've had a practice before, no problem. No need to do the movements, right? So you can just jump right on this before you go to bed. Guys, let's mobilize and improve our streamline.
Thoracic Windmill. We're going to be on the ground, getting on our side. If you have a foam roll or something equivalent to put your knee on, this is to lock our pelvis down so we're not excessively moving our pelvis during this motion, being the thoracic windmill. We're going to stay on our bottom shoulder, stacking our hands on top of each other, and we're going to initiate the movement by separating the fingertips and then reaching and rolling all the way around the body, all the way to the back. So when we are reaching and separating, it's important that we are activating as many muscles in our back and our shoulder blade as possible as we're rolling through. Another thing to maintain here is a long neck. As we're rolling through, it's easy to bring the shoulders towards the ears, and it's also easy to roll down to the ground to lose the tension. Tension is everything. That's why we want to be on the foam roll ideally, so the leg actually pushes down on the foam roll and even sometimes reaches forward with the knee slightly. So we get some engagement in the core and the hip flexors and the abs even slightly as we're trying to synchronize this whole movement, very similar to when we are swimming. This is a thoracic windmill, and with each repetition, we tend to get a little bit better and a little bit closer to the ground. Again, if we are hypermobile, this is not going to do us much. We might be on the ground all the way through. But if we're a tight swimmer and we have issues with the streamline, this is going to be really challenging. And after 5 repetitions here, I'm really feeling the muscles working hard. And after 10 repetitions, that arm is going to be really warmed up. And you can tell when someone has really good mobility versus poor mobility where the hand is in relationship to the ground and how much the elbow is bending. And you can tell that I'm really struggling here with my elbows, but I'm doing the best I can to not shrug my shoulder blade up to my neck and try to do my best to push my hand down towards the ground as it is rolling internally and externally. And as I'm finishing the movement, I am further reaching my hand up towards my back in more internal rotation. And again, each repetition, just pushing down a little bit further is the goal. So we are warming up the shoulder blades before we're going into more tissue mobility work. But we don't always have to only go into tissue mobility work. This is fantastic to do before we do any big movements in the weight room, such as pull-ups or presses overhead. Before swimming, doing 10 repetitions before jumping in the water, also very valuable to increase the range, increase the mobility. Again, thoracic windmill. And guys, the key is to really be patient and take time. Really feel what happens here, both in the shoulder blade and your back, but also in the hip flexor and the core. Is everything synchronizing and working together? And if it is, really, really good. Open book. Same position as the thoracic windmill with the knee staggered on top of a foam roll or something equivalent to lock the pelvis in. On our top shoulder, we are going to separate our hand and then initiate with the shoulder blade and make a thoracic rotation, very similar to the backstroke and freestyle. And we're going to go to an end range and then actively push down the hand as far as we can together with the elbow without losing the pressure from the ground on the bottom shoulder. Otherwise, we will actually get on the ground very easily, and that's easily done with young swimmers who doesn't like to set up the knee on the foam roll and pay attention to the pressure on the bottom arm. So again, stacked on top of each other with the hands, slide out, initiate with the shoulder blade, pull down and push back towards the ground, and repeat. Open book. We want to make sure that the shoulder stays in line with the shoulder and the hand. It's easy for swimmers to rotate and get the hand far back, closer towards the middle section of the back. So making sure that the hand goes straight in line with the shoulders and the other hand is key, and that's body awareness and might take time. And a coach or a swimmer, a peer, might want to adjust the hand into a proper position so we're not above the head or too far below the shoulder. Sleeper stretch. We are on the side on the ground. We are going to lift our elbow over our shoulder and gently push our hand down with our opposite hand and roll in and roll out. This is internal rotation, external rotation. Now, as I'm going internal and external, I'm actually putting pressure from the bottom arm to my top arm. So I am actually resisting it with the top arm. So we're getting a little bit of strength here in an external rotation. And similarly, as a stretch, we're getting a PNF stretch called proprioceptive neuromuscular facilitation. So we're actually getting more bang for our buck when we are doing this. The sleeper stretch If you're thinking high elbow catch position, very important, and also the major spot we get tension in the posterior shoulder capsule, it is called, and it's posterior deltoids, it is the lats, and it is going to limit the catch in the freestyle. And especially during the season when we're getting most broken down, these muscles tend to get more tight. So if we want to loosen them up at the same time, we can grab the foam roll and do very similar thing. And this way we want to keep the elbow all the way out to the shoulder blade and the arm on the foam roll. So you're feeling the shoulder blade and the lat here. If we don't have enough muscle, if we don't have musculature developed, this might be really uncomfortable and just a lot of pressure on the shoulder blade onto the shoulder. So be careful. If you have muscle, this might be a more suited and more appropriate for you. So be careful and keep staying active here. And I am also now helping out into an external rotation and getting more onto my external or my posterior deltoid even. Now switching sides, you get to see a different angle on my other side, which is slightly more limited as far as pain. I have a little bit more pain on the left shoulder, but I have more range on my left shoulder. So pay attention here how it's feeling. It should be a mild discomfort. If you have too much pinching going on, you should stop and go see your physical therapist, or try to position yourself in a spot where it is a little bit milder, where you feel that the muscles are actually stretching. If you're not feeling a stretch, you may not be in a spot where you have tension. So again, you can see that my feet are staggered and I'm not moving my hips either. So if you open up your hips from the bottom, this stretch will not be effective either. And with my hand, I am giving myself a little massage because I'm feeling a little tender in the posterior capsule in the back of the shoulder, the posterior deltoid. And then again, putting the foam roll on there to roll it out before I'm going into a sleeper stretch on this other side. And notice here, I'm rolling my shoulder both externally and internally. So I'm actually supinating my arm and then pronating my arm as much as I can as well. So I get full range and also moving around this range as much as possible to get activation, because when we're swimming, we have to be stable and active in all spots. And as you're moving, you will actually get to feel how the body is doing. Your body is talking to you in this position. And the more advanced you are and the more you've been on this foam roll, the more you can actually push yourself. If you're uncomfortable in the foam roll, skip the foam roll and just stay on the ground. Next, we're moving over to the peanut ball. This is the key secret to why my Streamline is getting better as I get older. If I had this as a teenager and throughout college, I am guaranteed that I would have swam a lot faster and had significantly less injuries. So what we do here, we place it on the ground and we're gonna find our middle to lower back. Not quite the lower back, but just right above. This is called our lower trapezius muscles. That's where they're gonna attach. And what we're gonna do from here, we're gonna scan all the way up to our neck slowly. The key position here is that we're going to try to maintain pressure on the ground with our abs. Maintain a long neck and then slowly slide all the way down. And as we do that, lower back pushes down, and long neck by reaching your fingertips down towards the ground. As we get up to the neck, slowly bring your arms over your head. Gentle discomfort here. The more you've been on this ball, the more pressure you can put. And I'm going to get into some positions that a lot of you guys might find very, very uncomfortable. It is safe as long as you are building in the pressure. But what I'm doing here now, I'm putting the ball on my neck. So I'm starting by feeling how the attachments on the muscles on the trapezius going all the way up to my neck and how they are feeling. Typically, my right side is a little bit more tender than my left, and flexing and extending the spine and even lifting the hips up is putting a lot of pressure in towards those muscles. And what we have in here is a supraspinatus muscle, and this muscle tends to get most inflamed in any in all swimmers. This is the majority of inflammation in swimmers, which is right underneath or right around the neck area, underneath the traps, called the supraspinatus muscle. And it helps us overhead positions, it helps us with the catch and also with the recovery in the strokes. So it gets overworked, and by me putting my hips up and putting pressure onto the ball is really pushing my first rib cage down and setting myself up to be in a better streamline position. Now, I am in the best streamline position that I possibly can be in, and I want you guys to be in the best streamline position that you possibly can be in too, and avoid arching your lower back. If your lower back arches, we are actually putting pressure away from the ball, and that is not good, and that's not how we want to do our underwater streamline as we are pushing off of the walls. Now, as you are here, keep moving your arms. Movement is key. I do not want you guys to get too stagnant, even though you guys can take deep breaths for about 5 to 10 seconds, but after that, keep moving. Anytime your hips come up, it's a lot more pressure, so you do not have to do this, but I do want you guys to try to push your hands down through the ground as much as you can and move your arms in any way that your body is telling you that it is okay. If it gets too pinchy, if it's beyond muscle pain, and you kind of know if you've gotten a massage in the past, how it should feel like or how it can feel like, that's what we're looking for. Again, anything that is burning, anything that is pinching or shooting anywhere is a sign that we might have a lot of damage going on here. Physical therapist, it is. So again, combining this ball with the movements, and we do need to be warmed up. So either before practice, then we do need to do some movements before we get on these balls, or after practice, or at night before bedtime. The more time you spend here, depending on how tight you are and how limited you are, the more bang we're going to get for our buck, and the better we're going to recover, the better our streamlines will be, and the more effective our strokes will be in the water. Here I am cupping my head with my arms, and I'm actually pulling my neck further out as I'm getting lower and lower on my spine. So we typically want to do anywhere from 2 to 3 all the way up to 10 repetitions per vertebrae. So if I started on my neck, you have seen me now slide down. I'm very close to my shoulder blades, if not right around my shoulder blades. And you cannot tell, but I'm doing very small micro contractions, very micro rolls with my shoulder blades, and even bumping up and down with my hips to dig a little bit further. You guys have seen these massage guns. If you are adding vibrations with your body, it's similar stuff, but it's just not as fast in frequency. And it's not comfortable either, but it is effective. This peanut ball is influenced by Dr. Kelly Starrett with Supple Leopard, or now the Ready State, and he keeps emphasizing to avoid the pain phase. And as you can tell, I do show my pain phase quite often, but I do what I can to relax and come back to normal and breathe out. So the breath here is going to control essentially how we are going to relax. If you make a big face the whole time and hold your breath, we will not be relaxing as much as we think that we are. So again, when you find a spot, and now I am on my lower trapezius, many swimmers get really tight and tender here because we get really inactive by all the overhead motions. And these are muscles that are really important to stay active. And what you cannot tell here is that I'm actually, as I'm coming down, trying to push my back down as far as I can by engaging the muscles that are on the ball without letting my lower back arch up. So my abs are always engaged. Abs have to have that little tension. If the abs tension loses, your lower back will arch, and you will actually not get as much effectiveness onto the ball here. What I'm doing now is I'm hugging my knees to put extra pressure on the ball. This is not recommended unless you have some underlying relationship with this peanut ball, because this can be really tender and it can be really painful, but really good because this is forcing our lower back to be on the ground, and it is forcing our upper back to also extend very similarly to where we want to be in a streamline position. So here, take some breaths and play around with the motion and see what your body is allowing you to do and what is restricted. If you crunch up over the ball with your knees hugged, that is even further pressure, because research has shown if we want to elongate any muscles, we have to put tremendous amounts of force onto the muscles. So simply just foam rolling it doesn't help, and just rolling it on the peanut is not going to help either. But if we can find a way to create some pressure, but also once we are getting really tender, to engage the muscles in those appropriate positions, that is when we are simulating very swimming specific positions, but also loosening up and recovering these muscles that have been overworking for so many thousands of yards or meters. And guys, there is no real right or wrong way of doing this except for excessive pain or to stagnance of positions. So you can always be creative of getting into some spots and positions that you may not have seen. And it is okay as long as you're contracting and trying to find the muscles that is actually on the ball is going to be the best thing for you. And here is another angle for you to see for how I'm finding essentially different vertebrae and how I'm reaching out and reaching into different spots and how I'm cupping my head and even pulling my head away to promote a long neck, to promote a much longer spine and a better body line. My shoulders are very internally rotated when I'm doing my streamline. I don't know if you have seen Caleb Dressel do his streamline, but his hands are actually in that little position where he is overly internally rotated and his palms are making a little cup, essentially, if you will, or sphere-like shape with his hand to potentially make his streamline much faster and more effective than anyone else. And when I've been in the water, I have felt that that is a really effective position to be in. And if you are just in a regular position where you are as close to streamline as possible, there are many ways we can reach and get as tall as we can. So I like to both put my thumbs locked each other and move my arms back and reach back, but also to mix that up with a regular streamline. Now we're doing a sleeper stretch with the peanut ball, and this is going to be very tender. We're going to start at the very lower bottom position of where the lats essentially attach, and we're slowly going to move our body downwards so we get the ball up towards our armpits slowly. So I am positioning my arm as far up as I can and slowly rotating inward, rotating outward maximally while I'm rolling onto the ball and rolling off the ball over the rib cage. And there might be some areas here that you might find very tender. My right side is more tight than my left, but my left is in more pain. So my right side, it's just a lot of tension here. There's nothing that is overly pinching here, but there's one spot that is overly tight, and you can tell on my facial expression here, right? So if we do a lot of pull-ups, a lot of rowing, and a lot of swimming, these muscles are very, very tight. And now I'm getting to my posterior shoulder capsule, my posterior deltoid, and where my lat essentially finishes up and meets my tricep and the posterior deltoid. But these muscles get really tired. And this is where we were on the sleeper stretch again. And I'm trying to find a spot where the muscles are the tightest and move around those muscles. And here I'm relaxing my head on my shoulder, taking some deep breaths and relaxing as much as possible. And guys, just move around here with a little bit of activity. And right here, after scanning from the bottom and up, you will have a good understanding of where your body is feeling a little bit more tense and where your limitation might be in a certain movement or just in this stretch. So again, I'm highly encouraging you guys to get to know your body a little bit better and to contract and relax. And this is going to help your swimming career by improving your streamline, by reducing your injuries, and improving your catch position to be more effective in your stroke. If this is really painful for you and you are choosing to avoid it because of the muscular pain, it's not a good reason. This is actually really cheap physical therapy for you. And the longer you stay on this, the better your body and your mind will actually feel, and the more you can bring to practice the next day, whether that is in the water or in the weight room. Guys, this is a reason I am still able to do pull-ups the way I'm doing and still being able to sprint as I'm a 30-year-old, just being a second away from my best time from college by only swimming twice a week and lifting 2 to 3 days a week. And I'm doing this kind of stuff a lot more than I used to do when I was in college. And this is on a daily basis, even to a bi-daily basis. So right now we're showing you guys upper body. You can certainly go in and do lower body and take as much time as you need. Now this left side, this is where I have some pain, and it's pinching in 4 different positions on my left shoulder from my old college days. And it starts on the very lower position on my lat. It goes all the way up to my neck and also goes behind my armpits in the posterior shoulder capsule, if you will. So here I am simply trying to contract and roll my shoulder blade onto the ground a little bit more aggressively to engage the muscles there on the ball so I can rehab this muscle while I am on the ball. So I'm maximally contracting and reaching my arms into different positions while I am on the ball in the exact position where I'm feeling the pain. And it's typically recommended if you're in pain to really pay attention right underneath the area of pain and right above the area of pain. And if you are rolling through your lats from the bottom and up, you will definitely get a good idea of how your lats and how your posterior shoulder capsule is doing and how your ability is in this sleeper stretch that is so crucial for swimmers. As you can tell, I haven't moved much here. I'm still in the little lower part on my lat. On my right side, I moved up toward my armpit much quicker. So again, based on how your body is doing, you move up on your pace. Same thing if you are working with a bunch of swimmers and you have 10 to 20 peanuts. Let the swimmers go through their body parts based on how they're feeling, because there are going to be a lot of asymmetries and there's going to be areas that are going to be more painful and there are going to be areas that are just more tight and they're going to be a little different. And now I have finally moved myself up a little bit more. towards my posterior shoulder capsule where the lat goes all the way up. And this is where it gets a little bit more pinchy for me. And I am making sure though that with the top arm to put pressure, so I'm not putting excessive amount of pressure here, more than I can handle. Guys, that was open book with the peanut. I always love to finish in a child's pose position to loosen up and rotate, and that is how we get better.
Oh, by the way, if you like this video, do not hesitate, comment, share, and like this video, subscribe, and we have a lot more greatness coming for you.